incidence of cancer has been dramatically increasing in our country and worldwide as well. And it doesn't seem to have any disparity between the economic status. As a matter of fact, in our country, we have much larger population, and this actually contributes to a large cancer load which we would have, even though the actual incidence may be slightly less compared to the Western population. So which are the common cancers which can potentially be identified by simple tests, screening procedures, etc.? The most important ones are breast cancer, which is number 1 cancer in women, cervical cancer, which is number 2 in women, and then oral cancer, which seems to be happening in both men and women. And added to this, now we also have the burden of lung cancer, which has been increasing quite dramatically and affecting women as well. These are non-smokers, but women are affected. So let's take one by one. Now, as far as breast cancer goes, in general, you will find that individuals who are 40 years and above could possibly undergo clinical examination and ultrasound followed by mammogram. Mammogram is a low-dose X-ray which can be used to pick up any lesions in the breast. Now, there are certain conditions where, for example, if there is a hereditary background for the breast cancers, if some member of the family is affected and they are found to have a disease-causing mutation in critical genes like BRCA1 or 2, then we would advise MRI along with mammogram, so they alternate. Otherwise, mammogram is sufficient for most of the people, and this will need to be done initially every year. At least from 40 to 45, you could have the option of once every 2 years or once a year. But between 45 and 70, you will need it on a yearly basis. Coming to cervical cancer, now here the simple test called as pap smear can be done as an outpatient procedure by a gynecologist. And this smear which is taken will then be studied by pathologists. And if they find abnormality, they will intimate the gynecologist, who can then decide what needs to be done. In general, this is a very simple test which will detect these what we call as precancerous lesions much earlier before they become cancer. So you could actually treat these lesions with very simple methods at very low cost. Whereas once it becomes invasive and starts spreading, then both the cost financially and life-wise is at risk. Now, the third is oral cancer. Now, oral cancers again is one of the common elements or common cancers which we see here, and it is seen in both men and women, and this is particularly related to tobacco. And unfortunately, you will find tobacco usage has been increasing even amongst children. And this is not as but they use it in the form of gutka and other pan parag, etc., which have some amount of these tobacco elements. And it's very unfortunate that these children are taking to it, and that can cause oral conditions which can predispose to develop oral cancers. Examination wise, a simple oral examination by a physician is good enough, and they will need to inspect and then they touch the surface and look at it. So that will easily tell them whether there is cancer or not. And additionally, if they need it, they can always do a biopsy.